I mean, you mentioned cultural competency and training for physicians and other providers, and that I think your students were fortunate to, hear your 3-hour lecture. I mean, what is the status of training our healthcare providers throughout the country, not just in Philadelphia, Jefferson, or other medical schools, in terms of issues that they should know how to address with their LGBT patients?
At the Gay and Lesbian Medical Association, we are actively trying to pursue, as well as some other organizations, some standards of education such that every medical student, for instance, I happen to be a medical doctor, so I'll just talk about that particular profession, but standards that say every medical student graduating from this point forward should have a minimum of this many hours of LGBT training, and not just any training, but some sort of standardization of what that means. We're not there yet. We certainly have models in other states, for instance, in California through, who am I talking about? The healthcare. I'm sorry? No, I'm talking about the major insurer out there. Kaiser Permanente. They have developed an entire manual on LGBT health, and a lot of medical students or medical schools out in the West Coast do use that, but it is not something that is required across the board, as many other culturally competent modules are required by.
I have a question. It's maybe shared between Rebecca and Ernest. Our public policymakers, particularly in Washington, I think, for our community, when they see our community knocking on their door to lobby, they think immediately maybe what? Don't ask, don't tell, marriage equality, employment non-discrimination. What's the level of education of our public policymakers and their staffs down in Washington about these issues? I guess that's you, Rebecca.
I have to give a major exception before I give this answer, which is Representative Tammy Baldwin, who is an out lesbian. Who, luckily for us, loves health as no other issue. So her office does amazing work. I mean, I talk to them daily. We're Facebook friends at this point. No, but what I'd say is that for most representatives, they think as long as I vote the right way on ENDA, as long as I talk about don't ask, don't tell, we're fine. And when we have to go in all the time and say, no, I'm not here to talk to you about ENDA, and no, I don't want to meet with your LGBT staff member. I want to talk to your health staff member. No, I know that normally I would meet with the LGBT, and sometimes it's even like, sometimes we kind of slur the LGBT when we call up to set up appointments to get in with the right person. And I think that you have to walk into these offices and start with very, very basic education and be okay with that. And to say, this is what our health disparities look like. I know that you're used to dealing with health disparities in this context. Here's the overlap. One of my favorite fact sheets that we have is called All of the Above, which is a fact sheet that talks about what it means to be an LGBT person of color, that you can't just address a part of a person, you have to address all of what makes them up, what gives them health disparities. So we bring that kind of basic information forward, because you're right, they just focus on what people think of as the basic gay agenda.
I mean, the only thing I would add to that is that I think it's gotten much better than it used to be. There is now an LGBT caucus of the Congress that Tammy and a number of other members, I think they must have like 30 or 40 members
75.
now. Oh, excuse me, 75. Well, I mean, I went to a reception up on the Hill of the LGBT caucus, and it must have been 500 people there. So between the staffers and the lobbyists and the members, and there were a lot of members there. So I think that we have gone a long way from the days where people were afraid, for a variety of reasons, to affiliate themselves with the issues. The question still on the table is, can that group of 75 effectively drive the agenda of ENDA, don't ask, don't tell, these health questions that should have been no-brainers in the bill that got kicked out for no good reason. I mean, it really was not. It was at a certain point where it wasn't about the money, it was about how much risk can you ask people to take, which is really, pitiful, but that's the facts. It was like, how much risk am I going to make this member take, and am I prepared to have a member in a purple district run the risk of having voted for this and have it pulled out by a party person, and run an ad on it, and that's the fact. And so we're not where we need to be, but it's better than it used to be.
And the only thing I would want to add to that is, although it's vitally important that people who are down in Washington talk to our representatives, it is crucial that every one of you in the room contact your own representatives and be that voice, because they will listen to us because we go down there and they know us, but they will listen to you because you are the person they work for. So remember that. You need to call your Congress people.
And I think that gets to sort of action. You know, what is it that this community can do? And I'm making an assumption that Ernest, your website at San Francisco AIDS, Mazzoni, and Rebecca has just tons of information on her website on what these disparities are and sort of what talking points are. So I would encourage those folks who are interested in doing it to sort of check out their websites and get some information, arm yourselves with that education.